Good evening, everybody, and welcome to the live Monica Makes It Happen Facebook show. So many hundreds of shows. We're always talking about what you want to talk about, and you want to talk about monkeypox right now. We have a doctor live with us. She is taking at least 10 to 15 minutes to talk and answer your questions live right this very minute. So please comment. Put your questions. We have a team of producers watching and monitoring them. I'm so appreciative to have Dr. Sira Madad of New York City Health and Hospitals Corp. We love New York City Health and Hospitals. Thank you so much for joining us tonight. I feel so honored to have you here. As you know, the CDC says that America ranks fourth for most monkeypox cases. We're talking about 1,469 right now. They rank the second for most monkeypox cases, again, in the United States, is New York, that with 414 cases right now. Tonight, I want to know, doctor, how did this start and how is it spreading?
Yeah, an excellent question. So first, what's important to know is that monkeypox is not a new virus. We have seen it before for many years. It's the first time it's causing this explosive growth of cases. And this is a very unusual outbreak, to say the least. So as you've mentioned, New York City, again, is the epicenter. First we had COVID and now with monkeypox. And so, I certainly do trust New Yorkers in knowing, what to do when it comes to infectious disease threats. And when we talk about monkeypox, and we'll get to, how can you protect yourself? But first, monkeypox, what we're seeing is very unusual with the rapid case counts. And we know case counts are going to continue to increase. The way that this virus is spreading is primarily really through contact of an individual that is infected. So contact through their skin or bodily fluids. You can spread it through, sex, oral, anal, or vaginal. So a lot of the cases that are being seen right now are primarily in the community of men who have sex with men that have multiple sexual partners. That's not to say we're not going to start seeing cases outside that particular social network. There is a very high possibility we're going to start seeing cases in women and children, just because as the nature of this outbreak continues to grow and it's hard to contain it, we're going to continue to see cases increase, unfortunately.
And everybody is commenting right now. Teresina's just asking, how contagious is this? It flows into the question of how severe, is it as severe as COVID, and how contagious is it?
So it's very different than COVID-19. So let me give you an example, right? So with the virus that causes COVID-19, it is transmitted, through the airborne route. So if somebody's in the elevator and is infected with COVID-19 and they start coughing and they leave that elevator, they're not wearing a mask. If somebody else comes in and they breathe in those viral particles, there's obviously a high risk of getting infected with COVID-19. Monkeypox is not like that. It's not as transmissible as COVID-19. There is, you can get it, as I've mentioned, through close contact, through droplet secretions. So if the virus, has, so in the secretions, in the respiratory secretions of individuals that are infected, if you're in close contact with them for a prolonged period of time, also through contaminated objects like bedding, contaminated surfaces. So somebody has lesions and has touched it. That's some of the primary ways of getting it. There's more information as we're learning more about this virus, but those are the primary modes of transmission.
Well, I hope we answered Chrissy's question, because that was Chrissy's question. Tamika, you have a great question too. How do you get it, and what can you do not to get it? We're talking about, that's the most important part, right?
Yeah. So as we talk about preventing monkeypox for the average person, some of the tools that we use for COVID-19 are what we can also use for monkeypox. And this includes, first, really good hand hygiene. So because we know monkeypox, is primarily spread a lot through contact transmission and really through contaminated surfaces or objects, just making sure that you are being vigilant on good hand hygiene. If you're around somebody that has monkeypox, make sure that they're wearing a mask and you're wearing a mask. Try to obviously keep your distance. The individual that's infected with monkeypox should be self-isolating in a room if they can, and if they're around other people, obviously wearing a mask. So just really being vigilant of some of these things that we've already been doing for COVID-19, and that's really what's going to help you prevent monkeypox as well. And if you are eligible to get vaccinated, and right now, as you know, in New York City, there are batches of vaccines that are being available to a certain population. For example, men that have sex with men, that have multiple sex partners within 14 days exposure, certainly sign up to get vaccinated.
And, my colleague, Kala Rama, just interviewed 2 people who have monkeypox right now via Zoom. This is what they said. Listen to Kala.
A few on each arm, some on my legs, some clusters on my back and my chest.
As a scientist specializing in infectious disease, Kyle Plank had monkeypox on his radar before the city's health alert.
It was pretty terrible, like fever, aches, pain.
Late last month, Kyle came down with flu-like symptoms thinking he had COVID, but a COVID test was negative. A few days later, a rash appeared. He was tested for monkeypox by the infectious disease team at Weill Cornell.
So it's a swab, but it's of the actual lesions in their throat and their mouth. And those are the ones that are super, super, super painful. There is no test that works that we have yet before the spots show up. So if somebody is feeling feverish and sick and things like that, there's no way to know if it's potentially monkeypox until the spots actually show up.
Tecovirimat is a 14-day FDA-approved treatment for smallpox, stockpiled under lock and key by the government in case of a bioterrorism event. Kyle's care team took on a lot of paperwork to cut through red tape to get him the treatment.
They're like black and orange. Yeah. So you take 3 of them at a time with a high-fat meal twice a day.
And within a couple of days of starting treatment, his lesions started healing.
I had about 30 at the worst, and about half of them started to shrink in size, and some of them began to just disappear, which was pretty crazy to see.
Kyle is now a part of a research study keeping a diary to look for potential side effects. Sebastian Cohn is a part of the same study.
I got probably the most intensely swollen lymph nodes I've ever experienced in my life. The combination of blisters, hives, and 103 degrees fever is out of this world.
He tried and was not able to get a vaccine appointment prior to contracting monkeypox. He's calling for equitable access to shots, as well as compassionate, competent care.
You can't send severely sick people around in circles when they're seeking care.
Monkeypox spreads through contact with the rash or sores. While anyone can get it, current cases are primarily spreading among gay, bisexual, and other men who have sex with men.
So many questions coming out of that package. Anna Torres says, what are the symptoms? I think the package, we saw 2 people with those symptoms. Can you just run through again for Anna? What are those symptoms?
Yeah, so the incubation period of monkeypox is 21 days, but people typically start, seeing symptoms anywhere between 7 to 14 days after their exposure. And it can start with kind of flu-like illness, a fever, cough, just feeling run down. And then it progresses into this rash stage, or kind of these pimples or blisters, if you will. And so they start out flat and they start to become raised with pus kind of in the middle as days and weeks progress. Now, I will say in this current outbreak, what's atypical is many individuals may not even have those initial flu-like symptoms, and they go right to the rash stage. And so what's important to remember is that if you have a new rash or a new sore that you haven't seen before, go ahead and get evaluated by your healthcare provider, because there's so much community transmission of monkeypox happening in the community that if you do see, a rash or a new onset of a rash or sore, just go ahead and get evaluated.
And Chrissy Snow, thanks for watching. She says, she's asking a very good question. Can you get monkeypox by someone who just kisses you hello on your cheek?
Yeah, so, when someone has monkeypox, we want to make sure that they are avoiding any kissing, hugging, any close contact, or any skin-to-skin contact, because if they have a lesion on their, let's just say their mouth, their face, and they're touching another individual's skin, and that skin may be broken, that is a potential portal of entry. And so just really important that you're keeping a distance and that you're also wearing a mask if you're in contact with somebody that is infected. I will say, when we talk about prevention of monkeypox, and not only your chances of getting it, but also spreading it to others, it's just really important that we are avoiding contact with others, especially when it comes to sex or any other close physical contact. And to make sure that you're getting evaluated by a healthcare provider. So if you have monkeypox, and if you are staying home and isolating, to contact your healthcare provider to see when is it safe for you to leave isolation and have that physical contact again.
Should people sign up to get a vaccination now, or should they wait?
So if you are in the eligibility group that New York State Department of Health has, meaning that you're in the group of men that have sex with men, transgender, bisexual, or a non-conforming gender, and you have multiple sexual partners, and you've been exposed within the past 14 days, certainly go ahead and sign up to get the monkeypox vaccine. As I mentioned, these are happening in batches, so it's a little bit harder to get an appointment at times because there is a bit of a run of appointments. But certainly, if you're eligible, I would certainly suggest that you get vaccinated.
Rapid fire questions now. Will it be as severe as COVID in 10 seconds?
No, it will not be as severe as COVID. This is not going to be a pandemic level threat like COVID-19. Hopefully not.
Fact or fiction? Monkeypox is a new virus.
It is not a new virus.
Monkeypox is a sexually transmitted disease.
It can be transmitted through sexual activities. It's not labeled as a sexually transmitted disease, but that is certainly under investigation right now.
That monkeypox only affects men in the LGBTQ community.
No, there have been cases of in women as well as in children.
And last, fact or fiction, I love this part. Monkeypox is just as severe as COVID-19. You say?
It is not as severe as COVID-19, but that's not to say that monkeypox is not a benign virus. People certainly have a lot of pain, need a lot of supportive treatment, supportive care. So it's not something to take lightly in that sense.
You were incredible. And I learned so much tonight. Paul, Joseph, Tanisha, Viola, thank you all of you for your comments. And of course, we're going to have a lot more information. We're going to post this on all of our social media platforms. And always watch us at 4:20 and 5:55 every night. Thank you, Doctor, for joining us. And thank you. We're making it happen.
Thank you.